There we go. Good morning, everybody. My name is Keelan McCool. I'm the Deputy Program Director for the Arizona Biomedical Research Center. And today we're going to be kind of going over the awardee training for this cohort. So the Arizona Biomedical Research Center was originally a commission that was established in 1984 and moved under the Department of Health Services in 2011. We changed our name, and right now we've got a team of about 6 people. We've got our program director and executive director, as well as 2 of our grant contract administrators and 2 interns. So the mission of the ABRC is to identify and support innovative biomedical research to improve the health of all Arizonans, which is why you guys are here. Our funding is controlled by the Disease Control Research Fund and the Health Research Fund. These specific grants are created using monies received from the tobacco tax, and these are all state funds, so it's relatively stable funding. A little bit about our staff. We have our Executive Director, Victor Waddell, Program Director, John Garcia, myself, Deputy Director, Keelan McCool, and then our Grant Administrator for the research grants is Teresa Caro.
Okay.
Our Finance Manager is Laura Sancerna, and then our Project Coordinator, Natasha Newsom. And then if you have any questions at a procurement level, our ABRC Procurement Officer is Brittany Manuel. The ABRC is split into 3 primary programs: the Public Cord Blood Program, our research grants, and research education. And you can take a look at our website at azdhs.gov/biomedical. This is where we posted all of the awards, and we usually update the information for different solicitations, events, and posting things like different documents that we receive, as well as annual report. Our next solicitation will be released this summer. And if you are interested in being a reviewer for the solicitation, there is a survey link under the Grant Reviewer tab. You can share this with colleagues, and we're always looking for new reviewers. There is a stipend for reviewing. And then this webinar will also be made available under the Documents tab. And then, like I mentioned, we also post our annual report. So Teresa will be reaching out to confirm our abstracts and headshots. That way we can include you guys in the next annual report. We typically publish this the 1st of January, so we begin working on it around October, November. And for this solicitation, we received 67 NIA LOIs and 124 IG LOIs. 61 NIAs were invited to apply and 66 IGs, and we awarded 23 NIAs and 8 IGs. So it was a relatively competitive process this year. Your contract is between the state of Arizona and your institution, so you are able to move it if you need to. If you're going from U of A to ASU, you just need the permission of both universities to be able to move it. Your purchase order will be for the initial 3-year contract. So the MPO and GAE number that you receive from this document will be used on the CER. Funding from years 1 to 3 will roll over automatically. There's no need for an amendment. The change orders for these MPOs can be expected when moving funds into the next fiscal year, but that initial MPO is valid for the full 3 years. So internally, we have to move things over to 25, 26, and so on. And an extension request will be required if you are planning to utilize any funding beyond the initial length of the contract, so for years 4 and 5. If there are any changes or additions to the PIs, the PI must be based in Arizona, and a copy of their CV will need to be provided to our biomedical inbox. For any sort of budget adjustments, you can go ahead and email biomedical. We don't need to do an amendment, but we can provide approval via email and just kind of move that around and update the CER accordingly. These are some reminders from procurement. A valid COI is required annually for PO issuance and payment. Our procurement officer will contact you for updates if this is applicable to your institution. Insurance coverages and amounts must match the insurance requirements outlined in the contract, and ADHS must be listed as the certificate holder. If the grantee is a public entity, the insurance requirements do not apply, and a certificate of self-insurance may be submitted. So again, these requirements do not apply to any state of Arizona agency, board, commission, or university. And a majority of our grants are U of A, ASU, NAU, things like that. So it doesn't necessarily apply. These are cost reimbursement grants. You must submit supporting documentation for the expenses along with that CER. So spreadsheets summarizing the expenses do not qualify. We're looking for the accounting ledgers with reports organized by those appropriate reporting categories, like personnel and ERE, supplies, equipment, indirects, and so on. If you want to move any money between lines, again, you can send a request to biomedical. No more than 10% can be spent on indirects and no more than 20% for equipment without prior approval. So everybody in this cohort has a project period of March 1st, 2025 to February 29th, 2028. We require quarterly reports. So that first one is going to be March to May and will be due June 30th. There is flexibility if you are not able to complete the CER, but just give us a heads up. So PIs and admins have been provided templates for Q1 to Q4. We start off with just one basic CER template. We have over 120 contracts right now, so we haven't been able to keep up with providing new templates. We kind of expect you to keep an eye on the funds that are being expensed and update that initial template accordingly. So we pre-filled it using that initial budget from the offer and acceptance. But again, that can be amended if necessary, and you would just update that approved budget column. So just check the approved budget and previous amounts billed for accuracy, and then you'll complete the columns current amount billed. If using the Excel template, columns E and F will auto-populate, and you'll just finish with your certification at the bottom left. So we'll need this CER along with supporting documentation and the PI's program report for that quarter. Once we have all three documents, we can go ahead and submit it to our finance for approval and invoicing to be processed. And again, a unique invoice number is required for processing CER. So I know U of A, ASU, a lot of those universities have a process that automatically generates one. If you are from any other institution, just make sure that you've got a process to keep one on there as well. So please double check all CER columns. Incorrect CERs will be returned and it delays payment. Supporting documentation needs to be attached separately. So if you could, those accounting ledgers, please, 2 separate documents. And it must be signed by an authorized individual and emailed to biomedical@azdhs.gov. Your contract may say invoicing at azdhs.gov, but that is the last step in our process. We have to get internal approvals from our program director, finance manager, and then move it on up to invoicing to be processed. So those are due 30 days after each quarter, and just let us know if anything comes up and we can process them later. So for PIs, the quarterly progress report, you should have received all 4 templates. Q1 through Q3, those are kind of interchangeable. It's got the same exact information. But our Q4 is an end of year template that requires a little bit more information and asks for things like publications. So if you do have any publications, make sure you're listing and it's related to this grant, make sure it's listing the Arizona Biomedical Research Center. And if you could provide us with a PDF copy when you submit that quarterly progress report, would be very much appreciated. We'd like to put those on our ABRC website, and we're currently putting together a library of publications from our research cohorts. So just answer the questions the way they're written. If it's asking for a percentage, you can just estimate a percentage and then give us a little bit of a narrative of the activity, not just on track. We want to know what's going on and want to read a little bit more about your projects. And then, as I mentioned earlier, we're going to have an annual report January 1st. So you'll be receiving information from Teresa. She'll ask for your updated abstract and photo. These are all going to be published online. And then In April of next year, we'll be having our annual ABRC Flint Research Conference. All awardees are expected to attend, and if the PI cannot make it, an eligible team member should attend and be available for questions for the poster session. Carryover will be automatically calculated by ABRC each year. If you do need an updated template, just reach out to us. We can do them on a case-by-case basis. If you have more than 50% of 1 year's funding unspent, you will be asked for an updated work plan and budget to explain how you plan to use those rolled over funds and complete the project in the time left. Extensions are permitted on a case-by-case basis after the 3rd year, and there are no extensions beyond 5 years. So I think I went over this a little bit. Make sure if you have any publications, presentations that are related to this funding that you received, make sure to give credit to Arizona Biomedical Research Center and not the commission. We no longer support patent endeavors, so please contact your technology office for discovery, disclosure, and patent requests. Purchases over $5,000, you must show justification amounts, receipts when requesting reimbursement on the CER. And the investigator's organization holds title to the equipment. We also do one-on-one site visits. This is typically in the 2nd or 3rd year of your award, but Teresa or myself will reach out to you to kind of set that up. We have some options for a virtual visit if you cannot do an in-person one-on-one, but just let us know. And here's the contact information. Teresa will typically be your first line of contact. She receives all of our CERs, program reports, things like that. And if she's not able to assist you, I'll be monitoring the biomedical inbox as well, or you can reach out to me directly. And then any procurement related questions, you can also copy Brittany. And that was everything. Do we have any questions? If you want, you can put them in the chat or raise your hand. Again, this presentation I will be posting on our ABRC website, so azdhs.gov/biomedical. I'll have the recording and the PowerPoint.
I have a question. So I got the IG grant, and then our account was just set up 2 days ago, and the report is due June 30th. So I think there has been significant delays because of like our ORSPA has been busy with so many things. And I know another investigator, his account has not been set up yet even. So do you have any, I mean, is that okay if you just mention that in the first quarterly report or any?
Yeah, a lot of our purchase orders have been delayed for the 1st quarter. So if there is any quarter that's going to have 0 expenditures, you're just going to put that 0, have it signed by somebody. And then the program report, you can also just state we haven't been able to get started yet. You put that 0% estimated completion and send it our way. That way we can just keep track of receiving all of the CERs and quarterly reports.
Thank you.
Yeah, no problem.
It looks like Mitch has his hand raised.
Okay. Thank you. I was going to ask about, I have several subcontractors. Do I need to reach out to them for all of their, do I just accumulate all their reports?
So if it's going to be classified under the professional outside services, you would just have the accounting ledger that matches that amount. We don't need all of the receipts from them. We don't do subawards. We don't keep track of that on our end. We just allow up to 50% of the award to go to professional and outside services.
Okay, thank you.
Yeah, no problem. Sam?
Hello, Caitlin. Sam from University of Arizona Sponsored Projects. And I just wanted to say, first, thank you to Teresa and to you, because you guys, we've been working with you guys for past years and you guys have been great. So I just wanted to say that first. And secondly, I have a question about the new CER template. I know that that was supposed to be implemented starting July 1st originally. Correct me if I'm wrong. But we've also been requested to start submitting the CERs that we need to submit in this past quarter using that template as well. Is that correct? Or what is the practice? What do you recommend that we do?
If you have access to that template, let me pull it up. The newest one is this very colorful one.
Correct.
So if you have access to that and you can fill it out, that would be the best one to use. That is our most recent version from finance. They haven't given us a hard date of when the old one will be rejected. So if you have one that's already completed, signed, we can still accept it. And we're accepting them up till June 30th at the moment. But if you have this one, we would prefer it. And if you need us to complete any templates for any contract, just email us and let us know and we can put those together.
Perfect. Thank you.
Yeah. Any other questions? Okay, well, thank you everybody for joining. We really appreciate it. And if you have any questions or concerns, you can reach out to that biomedical inbox. Teresa and I manage it together. Oh, John, would you like to say something?
Yeah, very quickly, I wanted to thank everybody for all their hard work and putting these fantastic projects together. I wish you all the best, and that you get the results that you were expecting. And if not, you know, it's all about learning and moving on from that to the next iteration. I want to, you know, just add on to what Sam said. Keelan, Teresa, they have really brought some great professionalism to the contract management process, and I know it's deeply appreciated by you guys, and we're looking forward to our continued relationship. There was one thing I didn't quite hear, and I wanted to make sure you understood, is that when it comes to subcontracting, you need 50%, only 50% or up to that amount can go out of state. The remainder has to stay in state. To what the other gentleman was saying about their subcontractees, yeah, that's up for you to gather their information so that you can report on the whole project and its progress. But yeah, you would maintain that information locally. But you know, it's always subject to audit. That's in the contract. Don't, you know, just hold on to it into the project files, and I think we're okay. Other than that, I just say go for it and have a very successful project, and we look forward to continuing to work with you. Thanks, Keelan.
Thank you, everybody.
Thank you.